article chosen for appraisal is titled "The Effect of Regular Exercise on Sleep Quality and Fatigue Among Female Student Dormitory Residents." The article was published in the Clinical Infectious Disease Journal, Volume 38, Issue 11, on the 1st of June 2004. The article explores details of a quasi-experimental study involving 67 participants which aimed to investigate the effects of regular aerobic exercise and sleep quality on fatigue levels among female students aged 18 to 26 who reside in dormitories. The study utilized one experimental group and one control group and was completed over a duration of 8 weeks. The experimental group of the study were assigned aerobic exercise of varying intensities every week, and the control group were assigned no exercise. From this, the study evaluated and compared sleep quality and fatigue levels of each group at a baseline, week 4 and weeks 8. The critical appraisal tool utilized for this article was the JBI Critical Appraisal Checklist for Quasi-Experimental Studies. This tool was chosen and deemed most suitable due to the high relevance and pertinence of the design of this particular study, being that it is a quasi-experimental study. Furthermore, this critical appraisal tool was developed following extensive peer review and allowed researchers to conduct a vigorous process to help inform the synthesis and interpretation of study results.
The article starts by explaining what sleep is and the various influences that affect how people sleep. It continues on to describe Iranian findings on sleep control in university students. In addition to these findings, it mentions a study undertaken in the United States of America, which discovered that between 27 and 60% of university students reported having low sleep quality. Literature can be useful because it will help the reader consider the subject that would be addressed in the article. It can provide insight into previous findings obtained from other research, as well as a prediction of what results to expect. The background information given in this article is important since it discusses factors that influence sleep quality in university students. Any questions or concerns that have appeared in previous research can also be discussed in the history literature. The literature further addresses the various data collection approaches that have been used in scientific studies that are close to those mentioned further along in this current article. This paper lacks the general history literature that you would like to see though, such as the scientific rationale for why exercise improves sleep efficiency and what happens to the body when it is exposed to a loss of sleep versus a healthy sleep. Following on from this, what is quality of sleep? What is defined by this statement and how can it be measured is also missing.
The study design used by researchers is a quasi-experimental research design. A quasi-experimental design aims to establish cause and effect relationship between an independent and dependent variable. This study design aims to appraise interventions without the use of randomization, and participants are selected by non-random criteria. Furthermore, a quasi-experimental design is shown in the literature to consist of 4 different study design groups, which are a quasi-experimental design without control groups, a quasi-experimental design that use control groups but no pretest, a quasi-experimental design that use control groups and pretests, and an interrupted time series designs. There are several notable strengths of the quasi-experimental study designs. These include that they are more time efficient and resource efficient, i.e. affordable, than that of randomized controlled trials. Furthermore, quasi-experimental studies allow for experiments to be conducted when other methods are unable to overcome ethical or practical barriers. Quasi-experimental experiments are also known to produce high external validity and generalization of results. However, quasi-experimental studies also present various limitations, including reduced internal validity compared to true experiments, lack of randomization leading to impacts on establishing causal association of the intervention, and vulnerability to confounding variables which may impact the study credibility when poorly designed. Additionally, quasi-experimental studies may be susceptible to maturation bias, i.e. outcome results impacted by natural changes occurring over time, reporting bias, reporting positive results only excluding the negative, and selection bias, when the intervention group is different from the baseline group. The use of a quasi-experimental design was suitable to use for the purpose of this study. This design allowed the researchers to access the sample populations in an ethical, timely, and cost-effective manner. The method used to obtain the sample population avoided randomization and implemented a broad section of participant criteria with the aim of minimizing the effects of confounding variables on the results of the study. Furthermore, the study was strengthened through the use of a control group. Another study design that may have been suitable for this experiment is a randomized control trial. Randomized control trials are thought to be the gold standard designs in experimental research. They offer high credibility, internal validity, and would still allow researchers to investigate the effects of aerobic exercise on sleep quality in female students. However, researchers would need to engage in further deliberations surrounding ethical considerations, sample size, cost, time, and other relevant changes in order to adhere to the process of a randomized control trial.
The study was conducted in 2 out of 8 dormitories at the Iran University of Medical Sciences, which were randomly selected to minimize selection bias. One of the dormitories was selected as the experimental group and the other was selected as the control group. The sample size was estimated based on the expected difference in study outcomes between the experimental and control groups. 2 groups with a total sample size of 80, 40 being in each group, was recruited to avoid follow-up losses. The final study sample included a total of 67 participants, 32 participants being in the experimental group and 35 participants being in the control group. The eligible participants were Iranian females between the ages of 18 and 26 who met the following criteria: had a BMI under 29, were non-smokers, had no use of acupuncture or other complementary medicines over the last 6 months, and no exposure to stressful events over the past 3 months. They were not enrolled in the study or later dropped out based on the following criteria: a presence of mental illness or surgical history, unwillingness to continue the study, absent for 3 consecutive or 5 non-consecutive exercise sessions, involvement in daily physical activity beyond the study protocol, the use of complementary medicines or herbal therapy that influences sleep or fatigue level, for example, energy-enhancing drugs and or sleeping medications. The characteristics of the participants' demographics within both the controlled and the experimental groups were as follows. All participants were between the ages of 18 to 26. All participants had a BMI under 29. 14 participants were employed and 53 were unemployed. 62 participants reported their household economic status as good and 5 as average. 28.09% of participants were studying nursing and midwifery. 40.45% were studying management and statistics. 21.06% studying nutrition and health, and 10.4% were studying other. With the informed consent, the participants from both the controlled and the experimental groups individually completed a demographic questionnaire, the Pittsburgh Sleep Quality Index, or the PSQI, and the Multidimensional Fatigue Inventory, or the MFI-20. At the beginning of each exercise session, a digital heart rate display was worn around the wrists of the participants. Those participants were allocated in the experimental group or received aerobic exercise plans from an exercise specialist. The participants exercised with a trainer for 3 one-hour sessions every week for 8 consecutive weeks. Each session was scheduled from 5 p.m. to 6 p.m. and included the following: 10-minute warm-up, 35-minute of basic aerobic exercises, and a 15-minute cool-down. During the first 4 weeks of intervention, the participants performed the exercises at mild intensity, and in the second 4 weeks, the exercises were performed at moderate intensity. At the end of the first 4 weeks and the second 4 weeks, the PSQI and the MFI-20 questionnaire was completed by all participants from both the controlled and the experimental groups.
To identify whether or not regular aerobic exercise had an effect on the quality of sleep and fatigue levels on female students, a quasi-experimental study was formed. This consisted of 67 participants, 32 of which were the experimental group that would participate in hour-long aerobic exercises 3 times a week, and 35 within the control group that would not exercise. Sleep quality would be recorded by utilizing the Pittsburgh Sleep Quality Index in 6 categories: sleep quality, sleep latency, sleep duration, sleep efficiency, sleep disturbance, and daytime dysfunction. This index also takes into consideration sleep medication, although this was not necessary to the study as there were no participants who used sleep medication. The fatigue levels of the participants were also recorded using the multidimensional fatigue inventory, covering the 5 dimensions of fatigue: general fatigue, physical fatigue, mental fatigue, reduced activity, and reduced motivation. In addition to this, there were some measurement biases identified. One of these biases is medical issues. Medical issues such as insomnia may make it harder for participants to fall asleep and make it difficult for them to feel as though they are well rested, which could have an effect on the results. Anemia may also be another medical issue that could affect the results. Another bias that has been identified is sleep complications in participants that may have mental illnesses such as depression that have a major impact on the sleep quality of an individual. Physical impairments may also be considered as a bias in measurements, as participants that have physical injuries may prevent them from enduring a full aerobic exercise and feeling the full effects from it.
The analysis described and presented the results in a structured and methodical manner. The statistical assumptions from the test were respected, and the conclusions drawn respect the assumptions of the statistical test. This is seen as researchers tested for variable normality using Kolmogorov-Smirnov, and all variables were found to be non-normal, apart from BMI. Variables with non-normal distribution were tested with a Mann-Whitney test. An independent t-test was utilized for BMI, and comparison of qualitative data was performed via a chi-square and exact Fisher test. Statistical power analysis was performed, and the power value of the test was found to be 80%, meaning the experiment was likely to produce a statistically relevant result. This was corroborated by the test results in weeks 4 and 8, as the level of significance, p-value, is less than 0.001, creating a strong statistically significant difference, meaning the test hypothesis is accepted. Furthermore, researchers include results from the Friedman's test, these results further reinforcing the statistic relevancy of the research, with results displaying a value of less than 0.001. The research had a sample size of 67 participants. This larger sample size reduces the chances of researchers creating a type 2 error. Furthermore, the probability of a type 1 error occurring was found to be 5%. Overall, the inferences drawn from the data regarding cause and effect in this study can be considered strong and accurate due to adequate testing of variables and utilization of appropriate statistical procedures.
The protection of human subjects is achieved through correct application of ethical principles in any research study. These ethical principles provide an outline to potential risk to any subjects and must be reasonable and with anticipated benefits. These ethical considerations can be seen applied throughout this research article. Ethical principles in research include the use of confidentiality, informed consent, voluntary participation, and effective communication of results. This research article was seen to use informed consent, confidentiality, and effective communication of results.
This is seen as the researchers used a quasi-experiment method which does not rely on random assignment. Instead, subjects were assigned to groups based on non-random criteria. 2 random groups were allocated between 40 volunteers that met this selection criteria. These volunteers provided written consent with reassurance of confidentiality, with names and characteristics not being published within the article. However, within the study design section, there was no mention of an information sheet being provided to the participants. This would provide greater information to the participants regarding the purpose of the study and offer a clear understanding of what is expected and the desired outcome. This would allow the volunteers to make a more informed decision on their participation with awareness to the purpose, method, and risk of study.
The results accumulated from the study were gathered from a total of 67 participants, including 32 participants from the experimental group and 35 participants from the control group. There were no reported significant differences in demographic characteristics, sleep quality, and fatigue levels between the 2 groups at baseline. After the subjects were exposed to 4 and 8 weeks of aerobic exercise, the scores for sleep quality and the components within, excluding sleep duration 4 weeks in, were significantly lower than the control group. Aerobic exercise resulted in a significant reduction of total scores for fatigue level, and the components within weeks 4 and 8 compared to the control group. The results from the Freeman test portrayed significant improvement in all components of sleep quality and fatigue level in the treatment after completion of the experiment. Furthermore, a significant increase was observed in subjective quality, daytime dysfunction, and the global PSQI in the control group over the course of the intervention. Potential errors include participation bias, may have occurred when gathering subjective data, as the participants may provide inaccurate responses to the questionnaire due to placebo and/or other personal conflicts with the intervention, due to social pressure of the experiment or exaggeration of results. The results determined that 8 weeks of aerobic exercise was able to improve all sleep components. However, improvement in sleep duration was not significant after 4 weeks. It is demonstrated in the results that increasing the intensity of exercise from mild to moderate enhanced all aspects of quality of sleep. Both control and experimental groups underwent mid-semester exams during intervention, and results conclude that exercise had a positive influence on sleep quality during this time. In this regard, exercise should be used as a preventative measure for improved quality of sleep and reduction in fatigue. The majority of studies available support the positive effect aerobic exercise has on sleep. Although one Iranian quasi-experimental study did not support this, it was explained that the study had confounding demographic and consumable factors which may impact the validity of the study. Moreover, the intensity of physical activity may influence sleep differently. Since moderate exercise is identified as 65 to 70% of maximal heart rate, the results revealed in this article depicts that increasing exercise intensity from mild to moderate after 4 weeks could improve sleep quality. The article reported that this was supported by scope literature, including a systematic review which portrays the positive influence of moderate exercise on quality of sleep. The time of day that exercise is undertaken is a crucial element when scoping and undergoing interventions. Literature and results from a systematic review and meta-analysis support the positive influence moderate exercise has on sleep. However, more research is needed to identify the effects of exercise in other time periods. Furthermore, the literature about the frequency of physical activity has consistent findings about physical activity leading to improved sleep quality. In one study which surveyed athletes one day without physical activity resulted in a decreased quality of sleep, highlighting the importance of regular exercise. According to the results in this article, it is suggested that 4 and 8 weeks of aerobic exercise also improved fatigue levels and the components involved amongst university students. This is supported by literature in the clinical setting, where it is reported that aerobic exercise significantly reduced fatigue amongst patients living with multiple sclerosis and pulmonary arterial hypertension. The effects of exercise on fatigue and quality of sleep are strongly supported by an array of literature which explain the reduction of anxiety and physiological functions which occur during and post-exercise. As exercise can act as a catalyst for sleep due to homeostatic functions which involve temperature regulation mechanisms which enhance the quality of sleep. Also, the positive influence between physical activity and mental health is heavily supported from literature to decrease fatigue levels. The conclusions reported in the article outline the effects of poor sleep and the prevalence of daily fatigue amongst dormitory students. especially females, and suggests that non-pharmaceutical approaches are advised due to low health risks and accessibility. Given the results in the study, performing regular aerobic exercise with increasing intensity is recommended as a practical approach to improve fatigue and sleep quality amongst non-athletic students. The limitations and strengths were identified by the authors and group members, which are as followed. Limitations include the inconsistencies in daily sleep hours and daily routines among study participants need to be considered during interpretation of results. The female sample population reduces the applicability towards other gendered university students. Strengths include the use of the quasi-experimental design minimized the influence of confounding factors covariates, such as student interactions regarding the intervention and the process of the study. Also, utilizing university resources, which assisted with sample population engagement and time and cost effectiveness of study design.
The JBI Critical Appraisal Checklist for quasi-experimental studies doesn't provide an overall score or rating of the appraised article like other critical appraisal tools, but rather provides a checklist in which the appraiser can evaluate the paper. The JBI Critical Appraisal Tool is designed to evaluate the quality of a study and its methods and identify measures which a study has implemented to address any bias possibilities in the design, analysis, and conduct. This critical appraisal tool is easily implemented in the appraisal process and is comprised of 9 questions, with each question containing an area to mark labeled yes, no, unclear, and not applicable. It is then followed by an overall appraisal section to include or exclude the article. If an appraiser becomes unclear on what the individual questions are evaluating, then a guide is provided detailing what needs to be included in the article to meet the criteria. Upon completing the appraisal of this article, researchers identified that all the checklist criteria outlined in questions 1 to 9 in the JBI were met and received a yes response. Due to these results, researchers deemed this article to be an appropriate quasi-experimental study.